hopefully getting it in the water next spring.
Did it not go this year?
Well, it has been in the water for 3 years.
Oh, because of COVID?
COVID and then not having a place to dock it.
Oh, really?
You mean the one in Excelsior? Or-
Yeah, the guy that bought that restaurant where they used to dock it on the east side there,
Yeah.
well, they would no longer let us do that. And so there's no other place to tie up, so we couldn't put it in the water, which turned out to be a fortunate thing because then COVID came.
COVID, yes.
Well, otherwise, we would have had it in the water, would have had to pay all that expense to get it back out.
Sure.
We are ready when you are, Chair.
Thank you, ma'am. We'll call this meeting of the Senior Advisory Committee to order. Alyssa, since we're all here, is it possible just by consent to say we're all here and not do the roll call?
We can.
We got a big agenda, we got lots to talk about, so we'll keep moving. So this is the time for proclamations, suggestions, complaints, or other, input. Anybody hear anything from Victoria residents that you want to bring to the committee? I think we're good. We'll have time later for input from this group. We'll turn to Alyssa now for an update on city activities and events.
Great. So a few events I just wanted to share with the committee quick, and then I'll pass it over to Dawn to see if she has any updates for Carver County Public Health. But just to kick us off, we do have a Medicare Basics workshop coming to the Victoria Recreation Center in the next couple of months. So we have 2 sessions that will be offered for free at the Victoria Recreation Center. The first one's on October 13th at 2 p.m. And then we have a follow-up workshop for November 15th at 6 p.m. It will be just highlighting all what people need to know about Medicare, and it is going to be brought to the Victoria Recreation Center by a local insurance agent, Jennifer Balk.
Excuse me, I have a question on that. Will they do any more advertising than other in the book or on the website? Do they have the capacity to do email blasts or, post on the Facebook page through the Recreation Center?
Great question, Sue. Yes, they will be posting this on our social media channels as well as on our website to try and get the word out there, because this is going to be a great program offered to our residents. Again, it is free and anyone can participate. There is a registration that we are asking residents to sign up for, and that can also be done on the website. It's just to get a good count on how we can or where we can have this event. So. And then the last one I wanted to talk about is we're also offering additional pickleball sessions for beginners and advanced learners. Pickleball is a well-attended activity. It is gaining more and more popularity, so we wanted to offer additional classes for anyone, no matter what level you are at. So I do have those, the dates and the cost associated with those up on the screen. You can also find more information on the Victoria website as well as their social media channels as well.
What's the story on the courts while we're on pickleball?
Oh, good question. I don't have that information right up in front of me, but I know they have been working on it. For those aren't aware, the Victoria Recreation Center will be offering new outdoor pickleball courts behind the building where the skate park used to be, and the skate park is going to be relocated. So I know they're getting started on that. Time and cost, I'm not 100% sure on when that is supposed to be completed.
I've been there a few times, parked in the back, and they're moving along, and they look like they're doing a great job. And I know from playing pickleball, people are excited.
Yeah, that's great.
Say the least.
Anything else, Alyssa?
No, Chair. I will pass it over to Dawn to see if she has any updates for us.
Hello. I'm going to attend 2 senior expos at the end of the month. On the 28th, there's one in Chaska, and the 29th, there's one in Chanhassen, and I think they're open to anyone interested in attending. And then just in the COVID world, there is a new bivalent booster out and available, so I don't have a lot of information, but we are hosting clinics at the Government Center on Tuesdays still. And we'll be offering that booster for those interested.
Are the 2 expos that you mentioned similar to the one that we did?
Yes, and they're both a little different. So Chaska, they bus the residents in from a lot of their senior living apartments, and they offer lunch, and they have guest speakers during the lunch hour. Chanhassen, it looks like on their schedule, it's at their rec center, and they have several guest speakers also, or like sessions to attend.
Do you have the time on the Chanhassen one?
10:30 to 2:30.
And who would I contact to have a booth there for the library?
Mary Blazin from the Chanhassen Senior Center.
Okay, thank you.
It's on September 29th.
Yes. Yep.
And they're also having a flu shot clinic as well.
At their,
We're good?
Just a question. They talk about no charge. Does that mean you still have to have your insurance, or is it actually free?
for,
The flu or some of them for, I don't know which one or the other, or the COVID?
for the COVID, there's no charge. And if you're going to one of the public health hosted clinics, we don't need to see your insurance.
Okay,
If you're going to your healthcare provider, they already have that information, so they are still free of charge at this
Okay.
time. Just bring your vaccine card. That's the most important
oh, I'm sure.
piece, actually.
Good, thank you, Don. We have, next item of business is the approval of minutes from the last two meetings. We have a motion to approve the minutes.
I make a
Move.
Jack moves, Sue seconds. Any discussion? All those in favor say aye.
Aye.
And opposed, the same sign. Motion carries, our minutes are official. And I think we're ready for our presentation. I hope I get this right. Is it Xiong?
Yes.
Great. Welcome. We're anxious to hear about Trellis. You want to come up and stand here at the podium so we can all hear very well?
My original presenters I had coming could not make it today in person. And so I am brand new at this. When I say brand new, my background came from a marketing background. And so after I left my previous job, I came over to Trellis Human Services, so I'm still learning. So there are some things that I'm gonna go through in regards to Trellis, and there's a presentation that was supposed to be done today, but what I'll do is I'll send it over to Alyssa. I tried, but then it looks like it was too big, and so it got rejected, and so I'll try to send it again, and then she'll send it out to all of you guys, so you have all the resources and the websites on that presentation. Have all of you guys heard about Trellis?
Not sure what it is.
Yeah, okay, me neither when I first started, I had no clue what it was. So Trellis, we are one of the area agency on aging here in Minnesota. I believe there's about 6 of them throughout the whole entire state. We cover, when I say we, Trellis, me and my counterpart, her name is Diane Graham-Raff, we both cover the metro, so it includes the Anoka, Carver, Dakota, Hennepin, Ramsey, Scott, and Washington. So I'm gonna just talk a little bit about my role and Diane's role, and then I'll dive into Trellis in itself. So what I do is I'm what they call the Elder Care Development Partnership Coordinator. Diane and I, we both have that role. So I'm assigned to Anoka, I'm assigned to Carver, Dakota, Scott, and Hennepin County. And Diane then has Anoka, Washington, and Ramsey County. So what our role is we provide technical support for organizations, nonprofit providers, if they're looking for like funding and things like that. We work closely with the state too, since they have 2 really big grants that they usually do a request for proposal every year. So they have the Live Well at Home grant, and these are for different nonprofit organizations. I mean, we have for-profit organizations that have applied to, but it's really going towards nonprofit. And then we also have the dementia grant. So Diane and I, what we do is we help organizations navigate the grant piece when it comes to trying to file So we help with that, and we help organizations find and partner up with different partnerships, so they're all not doing the same work and not knowing that they're doing the same work, where they can partner up together and do their project, whatever they have in mind for the elders, better. So that's kind of a little bit of what Diane and I do. Trellis in itself, so our department, we have what we call the Older Americans Act funding. And so we feel that funding to organizations to help provide money, so these organizations, providers can provide different services for our older adults, we say 60 plus. So we work with organizations such as so CWA is one of the ones that we work with. We work with Volunteers of America. We work with Building Together. And what they usually do is it used to be 2 years, but we're trying to make it change to 3 years with our funding. So for example, our Older Americans Act funding, next year, 2023, between June and July, we're gonna send out a request for proposal to these nonprofit organizations. And we call it, they can then compete or apply for the grant that we have to help service their projects that they want to do for olders who are 60 plus. And then we also have then the Senior Linkage Line. Have you guys all heard a little bit about the Senior Linkage Line? Okay, great. So our Senior Linkage Line, with the AAAs in Minnesota, we're one of the ones that actually have a hub where our elders and our caregivers can call, whether if they have questions or ways on getting transportation, homemaker support. So like if you needed someone to come and help clean your home throughout the week, or if you needed your windows fixed, or your steps fixed, or you needed to update your bathroom. So it really depends on it's income based too as well. There are a lot of organizations we have that do have free programs where if your income is not there, then we try to find a program that fits, so then you can get that done for free. So a lot of our caregivers and elders, they usually call our Senior Linkage Line for that. And we also then provide for Medicare. It's actually coming up here in October, Medicare enrollment, unbiased support for that. So if you call and want to know like the differences between Medicare and what's going to best fit you during the time of enrollment, we have reps who can help assist you with that too, with the Senior Linkage Line. So, and that is coming up here in October. So when you guys were talking about Medicare program, what you guys were going to do, like we have something similar to the phone number and everything is on that presentation. So I will definitely get it out to Alyssa so she can get it out to all of you guys so you can get the word out. But that's a little bit of what Trellis is. There's still a lot of programs and services we have, but I'm still pretty new at it. And so I don't know all of the programs and services that we have, but I definitely do have it in the presentation that you can read about. And if you have any questions, still feel free to reach out to me, and I can designate and get you guys out to the right department with questions. Anyone have any questions?
You mentioned Volunteers of America.
Yes.
Are they active in the metro area? To my knowledge, they don't really have a presence in our areas.
Yeah,
And
so-
what do they do anymore? I mean, I knew of them a number of years ago. I haven't heard of their involvement for years.
Yeah, so Volunteers America, one of the main organizations we work with is out in North Minneapolis. And so they're really kind of covering that area more. I mean, they're pretty big. So that is just one of the organizations that we are currently funding. I'm not aware of all the other ones throughout Minnesota. And they're still doing their usual providing meals to older adults, providing homemaker chore services, as I mentioned about having someone come in to help them clean their house or fix their stairs. I can definitely look into if they have connections with other organizations of the same within the
Trevor
suburban
County.
area. Yeah.
Great,
And then
thank you.
I'll provide that information to Alyssa.
Thank
too.
you.
Yeah.
Is this page you're on live to the extent that you could hit programs and health partnerships drop down so we could see what's under there?
Yeah, so
Thank
we
you.
are actually doing a little tweak to it, so it'll be easier. We're kind of working on it. So what we wanted to do was, it showed the different organizations that we help support. And then what happens when you click on that organization, it'll tell you what they do and how they can help support elders and their caregivers. So we're making a tweak on that. I'm not sure exactly when it's gonna come out, but it does talk about like our Juniper programs, our Juniper classes, because they do a lot of fall prevention exercises and chronic disease too as well. And then we have what we called dementia friendly too as well. And they help communities and businesses become more dementia aware. So when someone comes into their business that have dementia, they're aware of how to help that individual that comes into their business or their
Does Trellis now provide the Dementia Friends training to organizations that you take to businesses as well?
We do, yep, we do. I know West St. Paul is really, they're like all about that, and they're also age-friendly Minnesota too as well. We actually have a dementia summit coming up here, and it's free, September 29th, and I'll send the link out to Alyssa too, but anyone can register. We do have a virtual option. It seems like that has been really popular. We have 3 in-person ones too. One is in St. Paul at the Crondelat Village. It's just that the in-person one, they limited space. So the one in Crondelat Village, there's only 60 people. And then there's also one out in Duluth and then one down south. So, but I'll send that link out to Alyssa so anyone can attend. It is a whole day summit, so.
It's interesting you should mention that because I walked in here today with this copy of Dementia Friendly at Work Training that one of the women from the city offices handed me this morning because, as most of you know, I volunteer in the city offices on Monday morning. I've been doing that for a year. And I walked in this morning and noticed for the first time, there's a sticker on the door that says Dementia Friendly Workplace. And I walked in and I said to Gina and to Laura, what does that mean? And Gina went and pulled this out and said that the city of Victoria had actually had the trainers come in and train in the work site, the dementia-friendly work training, but this is from 2016. So apparently that type of resource is still available.
Oh yeah, for sure. We started partnering up with dental offices to have their staff be more aware of, the dementia friend. And I know Roseville is really, really big. I hear that one of the things that they're doing is, so if you're an elder and you have dementia, you're wearing like a lanyard, let's just say with sunflowers. So that when someone sees you, they're aware to say, oh, it seems like you have dementia. So like they know how to help assist that individual better, or they have pins of a sunflower. So if you're wearing that pin, they know how to better assist you in that way. So every city kind of does their own different thing. West St. Paul is really trying to work with the smaller organizations now. So for example, I was in a meeting and they talked about meeting with Dunkin' Donuts. And so the manager there, he's like, oh yeah, my grandfather, he has dementia. So I would like to make my business and my organization more dementia friendly. Then they work with the city to get that going for his business and his organization. So everyone, they do it differently.
And then just one update from public health is we just had to recently turn in our SHIP, the Statewide Health Improvement Partnership work plan. And in that work plan, I put in for more of the dementia champions, so the training of the trainer for Dementia Friends, to bring that to Carver County if there is interest. So part of that right now, we work with District 112 and their intercultural specialists. We want to bring it in and tailor it towards the Somali community in Carver County. I know Chanhassen is looking at bringing in some more dementia champions training. So once there is interest, if you guys have interest, that's something public health can also help set up.
I believe that Chanhassen did the dementia-friendly training, probably started it 8 years ago and had been actively doing it for I don't know, the last couple of years, but they've trained a lot of people in businesses as well. And they have trainers that can train too.
Trainer has stepped down
Yes.
from doing that, and so they want to build the capacity to have more trainers. But my role is to then see countywide if other cities are interested in having more people trained also. So, sorry to interrupt, but we're having conversations on this also.
That's good. Is there any designation for like a dementia-friendly business, like a Blue Star Home, you know? This business.
There was talk about it. Do we create a sticker? Do we create something for the business? And it never really came to fruition, but there can be, yes.
Yeah, I mean, we have a dementia specialist, her name is Jen Rooney, so she, like, it's her work, and she does that throughout the whole metro as well as in the outer suburbs, so she's like our dementia, specialist. So I'll also provide her name, and so if anybody has any questions about the dementia friends and dementia-friendly community, she can definitely answer those questions.
One thing I would like to note for the committee as we're in September now and the year is winding down, we will be starting to look at our 2023 committee work plan. And if this is something of interest, we can talk further about making this more of a focus for 2023 for the committee.
Any idea how many people in Victoria have dementia?
No, I'm not even
Like
sure.
a state average or something?
Yeah, I mean, this is the first time we've actually been to the city of Victoria, just because our turnover has just kind of been going, and then when somebody starts to work, then someone leaves, and so we really haven't kept track. A lot of it is really in the Hennepin and Ramsey County area. So one of my goals is, and my plan is to try to reach out to more of the suburban area to let them know of the programs that we have. Any other questions?
Thank you.
I think we're good. Thank you very
Yeah,
much.
if you do, I'll provide everything to Alyssa, and she'll send it out to all of you guys. All right?
All right.
Thanks for having me.
Thank you for coming.
Melissa, are you going to present the results of our survey?
Yes, Chair, that is next on our list. Give me 1 second, I will pull up the presentation again. Here we are. Wonderful. So this April, the committee wanted to conduct a survey of senior recreational programming in the city of Victoria, seeing what the interests are, how people like to get communicated about recreational programming, and just get a feel for what we could do better as a city, as an organization, to better promote these recreational opportunities geared for the 55-plus population. So the survey was kicked off at our Senior Resource Expo in May, and we also offered it online, a digital survey for people to take. The digital version, as well as any written forms, ended or closed on August 10th. So we've taken this opportunity internally as staff to review the results of the survey and now bring the results to you and some recommendations on how to move forward. So with that, we had 52 respondents to the survey. A little over half of those were taken online, 63%. The other half were taken written either at the expo. We also offered written surveys at the Victoria Recreation Center for anyone to participate that way and turn them in. So out of those respondents, we had 83% that said they did partake in any recreational programs, participated or went to a park or went to a trail in this past year. Recreational programs could be anything related to pickleball, movies in the park, concerts in the park, family fun nights, truck rodeos, splash pads, any sort of recreational programs that the city offers, or fitness courses. We also asked if you have not participated in a recreational program offered by the city of Victoria, what was your reasoning? So 21% of respondents said they had not partake because they were unaware. An additional 21% said they did not partake as they had no need for recreational programs. We had a 1% that did not have ample transportation to and from the programs, and all the other respondents either did not respond, or if they did, they noted that COVID-19 or just general busyness prevented them from partaking. So in follow-up, we then asked what other recreational programs or services they would like to see offered at the City of Victoria. Our responses varied. We didn't have a very clear forefront winner related to that, so I just generalized what the responses were. We had additional pickleball classes or open courts or clinics listed. Several wanted more technology, computer retirement planning classes. We also had social and group gatherings. Cards was a big one that people were looking for, card and board games, art courses, pottery courses, and then fishing opportunities, as well as any other sort of water sport activities, kayaking, canoeing, and so forth. And then more geared towards communication, we asked, how would you like to hear about recreational programs? And we were quite shocked on this result. 81% of respondents said they would like to hear about it through current communications. A majority said things like email, the city website, and social media. And then we had a few that noted the park and recreation brochure. And then either people did not respond, or they responded that they would like additional sort of communication, specifically postcards and newspaper advertising. So with that, just kind of quick overview, does the committee have any questions related to kind of the general results of the survey?
I'm trying to think how to say this. 52 respondents, not a lot. And did any of us take the survey?
I took it at the expo.
At the expo. But other than that, you have to, if you're not aware that there's a survey, you have to look for it. You know, I didn't, and unless you're signed up for updates from the rec center or the city, you're not aware of that. So how can we better communicate that is just something to think about for the future. To get a better response for what some needs and wants possibly could be.
Absolutely, and that can be something of discussion today. If the committee would like us to go back and further try and get more respondents for the survey, we'd be happy to do that as staff. And if the committee has any suggestions, this is a great opportunity to kind of discuss that.
I think Facebook postings, email blasts, and from some old marketing, don't they say people need, and not that we want to do that, you need to see a message 7 times before it sinks in and you respond. So, you know, as maybe we think about that, how can we better communicate that to our constituents as well as ones that aren't digitally connected?
I'm having a hard time trying to think of what you would communicate. I mean, we have all these programs, right? Park and Rec, at the rec center and so forth. So do you pick like big mass, or for each event, do you try to?
Well, you communicate that there's a survey online, we would like your response.
Yeah, sorry, I didn't mean about the survey, I meant
Okay.
about the actual activities. If we're gonna improve communication, I mean, how do you do that?
Does everyone get the Park and Rec catalog? Is it mailed to people or?
Yeah, it's a great question, Patrick, and if you don't mind, just coming closer to the mic
I'm
to
sorry.
speak. Yeah, so the question was, does everyone receive the park and recreation brochure? And they do. Anyone that is a Victoria resident does receive that in the mail. And then
Yeah.
if you are subscribed to the city, you will receive that via email as well. But to your question, Chair, one of the recommendations that staff, after receiving the results of the survey, one of our initial reactions was there's better ways that we can communicate that we do have recreation programs that are geared towards older adults. And one of the ways that we decided that would be a good way to do that is to tag or label those programs as senior focused. So that was something that we implemented a couple weeks ago on our Park and Recreation brochure online catalog. You can go and look for activities that are specific towards senior. We did not have that previously. Now, in part of that discussion, we recognize that as a committee, we've been asked that senior is maybe not the most appropriate word. It's not very age inclusive. So we thought maybe we shouldn't be advertising things as senior focused, but rather an additional term that could be used. So that was something we wanted also to bring up and discuss today, is what other identification terms can we use to brand these programs tailored towards older adults. And I have a few options up on the screen. We did look at neighboring communities, other communities in the metro as well as Minnesota. A lot of them do have senior-related programming and stick to using that term. That doesn't mean that we have to continue to use the word senior if the committee would rather do something different. And then we also provided about 4 different options that we've seen other organizations such as AARP and Trellis using instead of the word senior. So that was just one of the recommendations we wanted to bring up today.
I like 55 plus. That's what Minnetonka uses. And I go to classes in a variety of communities, but I'm starting a 55 plus yoga class this afternoon, just because that's a section of their catalog that is called out. And at 72, 55 sounds so young.
Yeah.
That it seems very friendly. Yet it gets the point across, so.
Are you looking for a decision today, like if we have agreement here, or what's the process?
If we do, well, first, it's just for discussion. So if there's any concerns about the survey, whether if we should go back and solicit more feedback from our residents and determining how we can do that, if that's what the committee decides, we can determine if there is a way that we'd rather identify or label senior-related programmings. That would be something we'd be looking for the committee to bring back to us today. If the committee decides that the 4 options that are not provided are something that we would be, or if the committee would like additional options, is what I should say, we can definitely get that feedback and come back to you at another meeting and provide additional options. So that's kind of the main thing for today.
I'm with Nancy, 55 plus. How about the rest of you folks?
Fine with me?
My thought is this, maybe an idea would be to communicate right where people live. So I would guess that you maybe have point people like at some of the communities like, well, Steiger Lake, you have us, but Adelwood, which is a 55 and older community right up in Chaska on 41.
Bethesda.
The one by, yeah, exactly. And, all those communities have like a rec center or a social room or something, or place for bulletin boards. Mm-hmm. And that maybe if we could get to someone that would post those kinds of informational things for that specific group, that a lot more people would see them.
Sure. What would you call them, Jenny? What title would you give her? Descriptor.
Well, I think the senior, yeah, I'd go with senior.
Senior works for you?
Yeah, works for me. I think a lot of people identify with that word, so to speak, and they would look at it because it would apply right to them.
Mm-hmm.
Yeah, so over at Trellis, we use a lot more of elders, and we do say experienced adults too as well. We definitely try to stay away from seniors, just because seniors can mean a few others too. And so when you say senior, some people automatically think senior in high school, and not just senior. So we do use elders as a lot of our terminologies, and when we talk about it, and because our programs are for 60 plus, we do say 60 plus programs as well. So those are the main ones that we use.
I think 55 plus would be a better definition. I mean, it cuts the line right there. You don't have to guess whether or not you're a senior, you just gotta know your birthday.
That's a good
If you
point.
can remember it, huh?
Yeah.
Yeah.
If you don't have dementia, you can't remember
Yeah.
birthday.
I see that Brooklyn Park in their brochures and showing their programs, they do have it as 55 plus, and Maple Grove as well. So that's kind of been pretty popular with all of the groups that I know. So
Jenny, would you object to 55 plus?
No, I mean, I kind of giggle because, you know, I'm a realtor and in real estate, and it still comes out of my mouth all the time, master suite, and it's supposed to be owner's suite now.
Oh, it's an old
I
suite.
get into all these little logistics now that I think
Yeah.
are correct, but.
Well, listen, I think there's consensus that 55 plus would be a good branding term or name for us to use.
We use it, I'm sorry, I was just gonna say, we use it in the library as a branding term as well.
Wonderful. Well, we will start making those changes to the website and start labeling our recreational programs as appropriate. So thank you for that. The other question, or I wouldn't necessarily call it a recommendation, but more discussion item for this morning for the committee is to determine if the city should consider offering new programs that might be of interest to Victoria's aging population. So the survey identified several programs that the city does not offer: gardening classes, technology classes, card and board game clubs. But in review of these programs, city staff recognize that several of these programs are offered at some of our neighboring communities, at organizations and government entities that are actually within the city. Like, for example, the library does offer computer classes and technology classes. So the staff would like just the kind of discussion from the committee and maybe a recommendation to whether additional programs should be researched, or as an additional option, staff could start collaborating and promoting these other organizations. And I guess the other option is always just staying with the status quo on what we currently do. But there is opportunity for us to better promote other organizations, or we can start looking into what it would take for us to start offering other programs in-house.
Patrick, I know you offered a grandchild program.
We're doing it this week.
Okay, okay.
And then we have a technology program coming up, and we just got a grant to do board games.
Okay. Do your programs appear, they don't appear in the city booklet? They only come, you have, and I'm very connected online, but you have to view those online, right? That's your main form of
Well,
communication.
three things. Number one, we do have a print brochure that's in all the
In the
libraries.
libraries.
And then we have our online website, and I don't remember for Victoria, I know in the past, we have included our programs in the rec center guide. I know we do that in the city of Chanhassen. I just can't remember from Victoria if we have one in the current, but I know in the summer one, we definitely list all of our summer programs.
Okay.
I can comment on that.
Yeah.
We do collaborate with the library and do have programs offered in the fall brochure. I think there's a bookmark attached to it as well this year, so if you're looking for a bookmark, you can clip that out. I cannot remember what page it's on, and I was just gonna pull up the brochure so people can take a look.
Oh,
Yeah, so two
it's
of
on
those-
page, the second to the last page.
Yeah, so two of those, technology training, we already do some of, we have some coming up. And once we get this board game grant going, we'll probably have a board game day at Victoria.
I wonder if anybody read this in the Chanhassen Villager? Okay. I guess after reading this, a thought I had, the Chanhassen Senior Center celebrated their 30th anniversary. Started, and it made me thinking, that was 30 years ago in 1992. So they had a vision 30 years ago. And I don't know if the city of Chanhassen was much bigger than the city of Victoria is nowadays. But when I look at the building going on around here, there's multiple, I mean, there's a lot of new homes for younger families, but there's also more townhomes, villas, condominiums going in. Do we need to think about a vision for some programming? And would it be time for a discussion about what might our vision for our active or 55-plus people in the city of Victoria be? Mentioned a number of things, and is it time that we think about what do we want programming and services possibly through Victoria look like for older adults?
That's a good comment, because like Chanhassen has their senior center right downtown. Chaska has one over there, and they call it the senior center. So that gives people a reason to know where to go, as opposed to Victoria. Do we come see Alyssa, or where would you go? Good question.
And I think too, the city's hit the mark with pickleball. I mean, pickleball's big. And that's for pretty active older adults.
Very
But
active, yes.
it just made me think, with our population growing, isn't in the next 30 years, isn't the city of Victoria supposed to surpass the city of Chaska in their population, down the road? So it just got me thinking, where and what might we want to look like in the future, and how could we as a committee possibly assist with that?
It's a good question. As I've sat back and watched this, it seems like Victoria is younger or smaller than some of these more established cities.
Yes.
But we're on kind of the same path. Like, is it time for us to have a senior center?
Well, I think that'd be a wonderful thing for next year's work plan, is to have that conversation. And the city is going to obviously have to expand. It's going to need a bigger space for City Hall. It's going to need a bigger space for a library. Lots of communities build a senior center and a library next to each other. The very first library I worked in Flint, Michigan, that's what it had. It had a senior center and a library right next door to it. Edina has that. So I think having that conversation of do we physically need a senior center? And if so, should it be standalone or with something else, would be a great thing to focus on next year.
It's a good idea.
And in my experience working with the different cities in the county, having that senior center, having that full-time senior center director kind of gives you the capacity to expand your programs, expand what you can offer, and have more things available for the community.
Yeah.
And Patrick, that's a good idea. I don't know if you know, way back, the city of Chanhassen and the library were in the lower level of City Hall. But, that's a vision, and even right now, I mean, we're fortunate enough to have Lions Park, to the pavilion to occasionally maybe offer additional programming there.
I think we're building a new fire station, aren't we? Over by my house, yeah.
Well, this is all great dialogue, and I have been taking notes on what that might look like. I think a visioning exercise sounds like a great idea, and I think that will give us a long-term vision onto what our programs will look like. That has been a challenge, just based on the limited amount of space that we have at our Victoria Recreation Center for different programs and activities. It's also been a challenge since we have a staff of 2 for all Victoria Recreation activities and park planning, so it's definitely limited our capacity as a city to expand our resources, dedicating more programs towards seniors. So that might be a really good exercise for us, is determine what that plan might be, and then think about the resources that could help us get to that goal.
And also maybe, listen, that plan, you've got a active, willing group in our committee. During that time, how can we help assist that, or even maybe host or help plan? Because, the Park and Rec staff is stretched pretty thin, and there are only 2 of them, but we've got some active people here who probably wouldn't, that could be part of the plan, to see about our involvement as a committee and what could we do in that vision.
Also, I just read someplace where you probably would know, Alyssa, that the city administrative offices are trying to expand, running out of room, so to speak, and may have to go somewhere else ultimately. Then why couldn't a senior room or share be part of that in the planning? So we could start working on it now, and if there is an administrative building built somewhere, or part of, as you say, the new fire hall or whatever it might be, that could be just a part of it automatically.
Absolutely. So the city council did approve a space needs study, I think late last year. So if that's something, you know, as the committee goes through this exercise, if this is something that the committee would like to pursue for 2023, you know, that would be something that they would recommend to city council, and then city council would move forward from there and maybe addend the city space needs plan and kind of plan for staffing and building appropriately at that point.
So what's the next step for us, Alyssa?
Great question. So I think for the next step for us as a committee is to, one, start really thinking about that 2023 work plan and what we really want to focus on. I know we also are in discussion of a walkability study. So I think it's just identifying where do we truly want to focus our attention for the rest of this year and then for the upcoming next year. And I think that might be a good conversation for us at the next meeting is to, you know, we have these three really big projects or potential projects, the walkability study, as we've discussed today, the dementia-friendly workplaces and how do we bring that online if we choose to do so, and this recreational programming visioning project. So identifying what we really truly want to focus our attention on. The months go by very, very quick. So I think we just really want to hone in on our projects and make a decision at the next meeting. Does that seem like a good path forward for the committee?
Yes.
Yes.
Good. Sue, do you have anything else? You got a big stack of papers there.
Oh, no, that's enough for now. My mind is always working. I have a lot of ideas, but,
Great.
yeah.
So we're at that point in the agenda when anybody can bring up a topic they would like or.
Share one last thing before we move on, if you don't mind. We did briefly talk if we wanted to push out the survey one more time to see if we have additional respondents. I didn't see any sort of consensus related to if we want to try again or if this is something we want to wait till that visioning exercise, if that's how we move forward.
I would say wait.
I would agree. That was my thought. Wait until we kind of focus in on the visioning and see if that's something we incorporate in our work plan.
Thank you.
We're good. Any other topics anybody wants to bring up under new business or other business?
I do have one. With the Medicare workshop, perhaps we as a committee, are there flyers or anything on it? Could we help each maybe try to maybe sign up, even though we're all on Medicare and know about it, or try to recruit some people? I know there's some big plan changes. I've heard that Medicare is actually going to go up 7 to 8% next year. Drug costs are going to go down. Maybe they can touch on that, but could we all try to invite someone to to one of the workshops? Try to help spread the word?
If that's the committee is interested, I can print off those flyers that I showed up on the screen right after the committee meeting, and we can get those handed out to you. And then if Trellis has anything related to that senior linkage line and what's coming up for that Medicare training in October, we'll send that out as well. I think that would be a great addition.
Yeah, I'll send that out. Our volunteer and outreach team, they do a lot on teaching Medicare too as well. I think we call it Medicare 101. And so we've been doing that obviously because of COVID and the pandemic, a lot via virtual. And I've attended actually one of those classes before, and it was just, you just go online to our website and just sign up for it whenever it's available. So you can attend it at your own home or wherever it is that you are at your own convenience. So we have that too. And our team is really now honing up to the Medicare because Medicare enrollment is coming up here in October. So I'll double check with them, see if there's any additional information, and I'll provide all of that to you.
Wonderful.
Yeah.
Any other new business? We're at the point where it's time to adjourn then. Is there a motion that we adjourn?
I do
Yeah,
have a
sorry, go
question. I'm unfortunately going to be out of town the next couple on the Mondays. Is there any way we could possibly, well, my one question, with the elections, do you think we'll actually meet? Isn't the general election on the 8th, Alyssa?
I'm gonna pull up the calendar, but the general election is on November 8th, that's correct, so it would be the Tuesday,
Okay,
And our meeting is November
7th.
7th.
7th. Yes, the 7th. I would plan on still having that, however, we can change it if schedules conflict. And we can take that offline as well, and we can email about a possible meeting date if there's interest in switching those. And it would take some noticing on the city's part to make that happen, but that's easy.
Well, let's check while we're out here. Does anybody else have a conflict for the October or the November meeting? It would be October the 3rd, right?
Did you send out invites?
November the 7th? Those are the first Mondays?
The other option is, Sue, we can always take your comments in advance and I can present them on your behalf. That is another option that we have done before.
Actually, in the November, I'll probably be somewhere I could do it online.
That's the other thing I was gonna suggest. I was
can on the
gonna try that once.
Yeah, and the meeting law.
You have to notice it ahead of time, right?
And there is a little bit of extra differences now that the state has lifted the pandemic emergency health ruling. The open meeting law has reverted back to its original language. So we can partake in virtual meetings online. You do have to have some sort of reasoning behind it, and I can look more into information on what those listings are. And then you also have to participate in a public location. So if you're in a hotel, you cannot use a hotel room. Hotel lobbies are even questionable. It would be like a public park, a library, some sort of open space, wherever you might be. So the law has changed quite a bit, and I can provide more information on that to the committee.
I'm just wondering when we'll get to the work plan, if that will be in October or November or,
If you're not gonna be here, so I think it's really important, since you have this experience, that you have a voice in it, so I think we have to delay it a couple meetings, because it's a 2023 work plan, so as long as we get to it by December, I think we'll be fine. Sorry. I'm just trying to stay out of the sun, not because I'm a vampire. I've qualified that. I need to run, I'm sorry.
So what we can do is we can talk about the work plan later in the year, if that works for the committee. For the next meeting, we can dig a little bit more into the walkability study as planned and to kind of get more information related to that. And then at the next upcoming meetings, the plan was to take a look at our senior resource booklet to ensure that everything remains correct, or if there's any updates we'd like to make towards that as we're kind of